This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
But once patients have digested the news that they have breast cancer, many times the focus turns to treating it.
Yeah, different surgeries can do that. We've discussed a couple of them already today. But after the surgery, or even after radiation, there is another concern that could come up. It's called lymphedema. Basically, that's swelling in the extremities after lymph nodes are damaged or removed. Lymphedema can be mild, it can be severe. Lymphedema can be short-term, it can be long-term.
The bottom line is, if you or a loved one is battling breast cancer, it's important to educate yourself on lymphedema so you can lower your risk of developing it or prevent it from getting worse. And joining us today to help us is physical therapist Maria von Kollmar with Peninsula Regional Medical Center. Thanks for joining us this afternoon.
Thank you for having me.
So how does lymphedema develop?
Well, once the surgeon goes in to remove the cancer that's in an area, they may or may not work on the lymph nodes. So as the lymph nodes are removed or damaged or traumatized in any way, they then sort of have a decreased capacity to function in that area. So then fluid will then build up in the chest and in the arm.
So is there something we should look out for? Are there symptoms?
Yes, a lot of women will complain of tightness in their hand, in their arm, maybe the skin that starts to pit, which is if you push down on the hand or on your skin, it actually indents and then doesn't necessarily pop up rather quick. Some people complain of their shirts being tight. Some people complain of their jewelry being tight on their hand or on their wrist. Those are just signs that make you say, something's quite not right in that arm, and therefore needing to get back to see your surgeon and get that looked into.
And I understand some forms of lymphedema can occur right after yes. surgery, but then sometimes it can occur later?
Yes, it depends on, again, how many lymph nodes that the surgeon removed during the procedure. We have, again, an increased risk the minute one lymph node is removed. So then if you remove 50 to 75% of those lymph nodes, whatever the surgeon needs to do, therefore your risk definitely goes up. And it can happen immediately after surgery and it can happen years later.
So is there a way to reduce the risk of lymphedema?
Yes, if you want to make sure you're not traumatizing your hands or your skin in that affected arm in any way, make sure you wear gloves when you're doing housework and yard work. Make sure that you're if you're getting a manicure, you're being careful with your cuticles, not having your cuticles cut, making sure that you're moisturizing your arm, not shaving with a blade underneath your arm, but using an electric razor. Right. Simple things not to traumatize or bruise the arm. Very simple things such as not getting your blood pressure done or a needle stick, like an IV site or a blood draw in that arm, because that can actually be a trigger to cause lymphedema to get going.
Can I ask a stupid question? Why? Why does that trigger it?
Because the lymphatic system is right underneath the surface of the skin. So if you're taking a blood pressure with the massive amount of squeeze that a blood pressure does, right, you are actually going to then damage the lymphatic channels that are in the skin. Therefore, the arm will even cease to drain even more.
And you were talking about shaving with an electric razor.
Yes. You're
saying that with a regular razor, you actually remove part of the skin?
Right. We take the top layer of skin off, and that can be just enough of a trauma underneath the arm to trigger, or you can have a little minute cut that you're not aware of, and that one little cut in the skin will then allow bacteria to get in, which can then be a trigger for the swelling to occur.
Okay, so let's say that a patient has developed lymphedema. Is there a treatment? Is there anything to be done?
There is. If you think that you have an increased swelling in your body part, I would suggest that you go back to your surgeon or you go back to your primary physician to have that concern addressed by them appropriately. And then they will send you to the lymphedema therapist for an evaluation. And we are sort of the ones who decide what the treatment is. Do we start with a simple treatment or do we need to get right into true lymphatic drainage of the area, and then we kind of take it from there.
And you have a compression garment that some people wear.
I do. This is just a very basic garment. It has more pressure at the end, so that this would be the end that would be at your wrist, and of course it would stretch up to the forearm. But the idea is that it milks the fluid up out of your arm to get that additional fluid out. And the garments come in all sorts of shapes, sizes, colors, textures. This is a very bland one, but they can get pretty over the top.
Right.
Right. Thank you so much, Maria.
Thank you. Thank you for having us.
And to read more about PRMC or for more information on lymphedema, go to WBOC.com and click on our picture at the top of the page.
Okay, so lymphedema is just one possible side effect from cancer treatment. There's also hair loss. That can make a lot of breast cancer patients feel self-conscious. We're going to show you how a freezing cold cap may actually prevent that loss.
Hey, how about a little pink in your hair to show your support for breast cancer awareness? How these locks can go a long way toward finding a cure.
And a little later on, what type of role does nutrition play in keeping breast cancer at bay? You just might be surprised. Delmarva Life will be right back.